All right, today we're putting on our detective hats. We're about to dive into one of the most high-stakes medical mysteries out there, an ischemic stroke. We're going to follow the clues, piece by piece, from the very first signs of trouble all the way to the frantic race against time in the emergency room. So, the case file is officially open. Let's get to our first piece of evidence. So, what's the very first clue? It's just 2 words, but they tell you everything. Sudden onset. See, a stroke isn't something that creeps up on you over weeks. Nope. It's like a light switch being flipped off in the brain. 1 second life is completely normal. The next, it's a full-blown neurological emergency. That's suddenness. That's the absolute hallmark of what doctors call a brain attack.
And when that attack hits, the signs are dramatic and they are classic. You might see aphasia. That's where the ability to speak just vanishes. Words are gone. Or hemiparesis, this sudden, shocking weakness down one entire side of the body. And at first, it's not a tightness. It's this limp, flaccid paralysis. These are the brain's 911 calls. It's desperate signals for help.
Okay, so let's officially start our investigation. I want you to think of the brain like a bustling, complex city. And its arteries? That's the plumbing system. It's the pipes delivering all the essential stuff, oxygen, nutrients, to keep everything running. An ischemic stroke, at its core, is simple. One of those critical pipes just got blocked.
Now, this is an absolutely critical piece of the puzzle for any medical detective. You see, there are 2 main kinds of stroke. One is a bleed, where a pipe bursts. That's called a hemorrhagic stroke. But the one we're looking at today, the ischemic stroke, is the opposite. It's a blockage. It's a clog in the pipes. And figuring out which one it is, well, that changes everything about the emergency response. It's the first and most important question.
Okay, so if it's a blockage, the next logical question is, right, where in the world did this clog come from? And that brings us to the next chapter in our detective story, hunting down the clot culprits.
So our number 1 suspect, more often than not, is a condition called atrial fibrillation, or AFib for short. Basically, the top chambers of the heart stop beating in a nice, regular rhythm. Instead, they just kind of quiver chaotically. And when that happens, blood doesn't flow through smoothly. It can pool up in little corners of the heart, and that stagnant blood is the perfect breeding ground for dangerous little clots.
And this is where it gets wild, how a problem in the heart suddenly becomes a catastrophic problem in the brain. One of those little clots can just break free, get ejected from the heart into the bloodstream, and it's like a torpedo. It travels straight up into that intricate plumbing of the brain, finds a pipe that's too small, and bam, it gets stuck. Blockage.
But, AFib isn't the only bad guy here. This debris, as we're calling it, can come from a bunch of other places. Imagine, say, clumps of bacteria from an infection on a heart valve breaking off, or little pieces from a tear in the wall of a major artery, like the carotid. Even old, damaged heart valves or inflammation can create these rough patches where clots love to form. Really, any issue that creates junk in the bloodstream is a potential suspect.
So, let's recap. We know what happened, a blockage. And we've got a lineup of the usual suspects for why it happened. But now we get to the really cool part, the Sherlock Holmes part, figuring out exactly where, down to the millimeter, that blockage is located inside the brain.
And this is where the medical detective work becomes just mind-blowing. The brain is so incredibly specialized, right? Different parts do different things. So the patient's symptoms, they are not random. Every single symptom is a clue, like a breadcrumb that points to a very specific arterial territory, a specific pipe in the plumbing that's been blocked.
Okay, let's look at a classic case file, Wallenberg syndrome. Now get this. A patient might have a drooping eyelid on one side of their face, but they lose the feeling of pain and temperature on the opposite side of their whole body. How weird is that? This bizarre crisscrossing pattern of symptoms is a massive clue. You add in things like vertigo and uncontrollable hiccups, and a good doctor knows the problem isn't in the main part of the brain. It's a tiny little artery in the brainstem, the body's central switchboard, that's been blocked. Incredible.
And this concept just shows you the level of detail we're talking about. Take a stroke in the spinal cord. If the artery in the front of the cord gets blocked, a person might lose all power in their legs, and they can't feel pain or temperature. But because the back of the cord gets its blood from different pipes, their sense of position, being able to tell where your feet are without looking, that's perfectly fine. It's completely spared. So what's lost versus what's spared, that is the golden clue.
And these specific clues, they're everywhere once you know what to look for. A blockage in the thalamus, the brain's big sensory relay station. That can cause this awful, severe burning pain on one side of the body. A hit to the midbrain. You might get a paralyzed eye on one side and weakness on the other. and a temporary blockage, a TIA. That can cause what people describe as a curtain coming down over one eye. It's a huge warning sign.
Okay, so all the clues are pointing to an ischemic stroke. The diagnosis is made, and now our whole story shifts location and pace. We're moving to the emergency room, where this detective story turns into a frantic, desperate race against the clock.
There is one number that matters more than anything else right now. 4.5, 4.5 hours. That's it. That's the critical window from when the symptoms first started to when doctors can give a powerful clot-busting drug. You'll hear them say time is brain, and they mean it literally. Every single minute that ticks by, millions of brain cells are dying. The clock is ruthless.
So what's the very first move in the ER? An immediate, non-contrast CT scan. Why? Well, remember that first crucial question we had to answer? Is it a blockage or is it a bleed? This scan is the only way to know for sure, fast. If the scan shows no blood, then it's not a bleed. That confirms our diagnosis of an ischemic stroke, and it's green lights to move on to the clot-busting drugs.
You can literally think of this next part like a pilot's pre-flight checklist. It has to be done, and it has to be done right. First, did the symptoms start less than 4.5 hours ago? Check. Second, did that CT scan rule out a bleed? Check. And finally, the last critical safety check, blood pressure. You cannot give these powerful clot busters if the blood pressure is sky high. It's just too dangerous. So if it's above 180 systolic, they have to stop, give IV meds to bring it down, and then they can finally give the clot-busting drug RTPA.
Okay, the immediate crisis has been handled. The clotbuster is working, the plumbing is hopefully being cleared. But our detective story isn't over, not by a long shot. The final and maybe most important chapter is all about prevention. It's about making sure this never, ever happens again.
So to stop a sequel, we've got to go back to our original list of suspects and find out who the real culprit was. That means doing more detective work. We'll hook the patient up to a heart monitor for 24 hours to see if we can catch that sneaky AFib in the act. We'll do an ultrasound of the heart, a 2D echo, to literally look for any lurking clots or structural problems. And if we confirm it was AFib, then the long-term plan is clear. Anticoagulation. Drugs like warfarin that prevent the heart from making any more dangerous clots in the first place.
You know, when you look at this whole detective story, from the suddenness of the attack to tracing the clues to the race against time, it really hammers home just how fragile that plumbing system in our brain really is. And it leaves us with one last really big question to think about. Now that we know the risks, now that we know the culprits, what can we all do to better protect these absolutely vital supply lines?